Welcome and thank you for joining. My name is Trixie Thibodeau, Health Educator for Community Health at Atlantic Health System. Today's webinar is being presented by Riza Michelin, Health Educator for Tobacco Program for the Southern New Jersey Prenatal or Perinatal Cooperative. Before we begin, I have a few announcements. This webinar is being recorded. All participants are muted. If you have a question, please use the Q&A for questions or the chat for comments. We will try to get through all the questions at the end of the presentation. Are you or a loved one interested in smoking cessation? Atlantic Health System offers a free quit smoking program. This program includes individual assessment, free nicotine replacement products, and 6 weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups and other resources, or for additional dates and times, please call 1-844-472-8499.
All right, awesome. Well, good morning, everybody. Thank you, Trixie, for that great introduction. My name is Riza Michelin. I am the Tobacco Health Educator for the tobacco cessation programs at the Southern New Jersey Perinatal Cooperative. And today I'm going to be presenting Tobacco 101, which is the truth about tobacco. We are also not only a perinatal cooperative, but our tobacco program is the statewide partner for Tobacco Free for a Healthy NJ, which is one of the biggest collaboratives in New Jersey of partners that is trying to end tobacco use in our state. If you want to hear more about the initiatives for Tobacco Free for a Healthy New Jersey, you can visit tobaccofreeforahealthynj.com. And Tobacco Free for a Healthy New Jersey is a program of SNJPC and is funded by the New Jersey Department of Health, Department of Tobacco Control and Prevention. So let's get right into it. So just a very quick overview of what exactly we are going to be covering today. We're going to start off with smoking rates, both in the United States and in New Jersey, the leading causes of death in the United States and in New Jersey as well, cigarettes, electronic nicotine delivery systems. That is just a fancy word for e-cigarettes, things like vapes, disposable vapes, also environmental smoke. This is the second and third hand smoke that, anytime you smoke, you don't only affect yourself, you affect everybody around you. So we're going to give you some more information on that and also some quitting resources. So let's start off with the smoking rates in the United States. So 14 out of every 100 adults are current smokers, according to 2019 reported figures. So about 14%. Quitting smoking is the single best thing someone can do to prevent disease or death. Smoking accounts for about 1 in 5 deaths every single year. So if you think about that, that is 20% of all the deaths that occur, period. And all of those deaths would be prevented if it weren't for tobacco use. So think about all the lives that we could save if we were to end tobacco use in the United States. Now moving on to New Jersey smoking rate. So in 2017, New Jersey smoking rate was reported to be 14.1% for adults. That is higher than the national average, not by a lot, but it still goes to show that smoking still is a very big issue here in our home state of New Jersey. So now we're going to take a closer look at New Jersey and look at the smoking rates in each county. What you can infer from these statistics is that smoking is a little bit more prevalent in the southern part of our state. So we see an 18% in Cumberland County. We see 18% in Salem County. And, those are very high statistics, and it still remains to be a big issue throughout our entire state. But we see some slightly higher smoking rates down in South Jersey. So now moving on to the leading causes of death in the United States. So beginning with heart disease. Heart disease kills almost 650 people every single year. The CDC reports that 1 in 4 out of every death from cardiovascular disease, and that is what heart disease is, 1 in 4 is caused directly by tobacco usage. So think of 1/4 of the 650,000 lives we can save if we were to eliminate tobacco use. And then moving down to cancer, taking almost 600,000 lives every single year. And, you know, tobacco use causes cancer, almost 12 different types of cancer. Tobacco use affects almost every organ in your body, and it's been linked to kidney cancer, stomach cancer. 80% of lung cancer cases are suspected to be caused directly by tobacco use. And lung cancer is a very difficult diagnosis because it is very difficult to catch early. So usually when people get a diagnosis, it is more difficult to treat. Lung cancer is the leading cause of cancer death in women specifically. So think about all those lives we can save again if we were to eliminate tobacco use. Then skipping down over accidents to chronic lower respiratory diseases. This includes diseases like asthma, excuse me, asthma and COPD, or chronic obstructive pulmonary disease. So secondhand smoke, which is the smoke that burns at the butt of the cigarette or that someone breathes out when they smoke, is a major trigger for asthma attacks. And it has been reported that, you know, young kids have been exposed to secondhand smoke and have had fatal asthma attacks because all of those chemicals in the tobacco smoke is triggering their asthma. And talking about COPD, or chronic obstructive pulmonary disease, it is reported that 70 to 80% of every single COPD, or 70 to 80% of those COPD cases are directly caused by tobacco usage. And COPD is a very difficult diagnosis to have. There is no known cure as of right now, and is very difficult to live with. And then strokes. Smoking tobacco increases your risk of having a stroke by 3 to 4 times. And it's also can be very lethal. Strokes can be very lethal and can cause permanent disability. So these are all very serious diagnoses that can result from tobacco usage. And we see how tobacco contributes to the leading causes of death in the United States. Now moving on to New Jersey, if we take a look at these rankings, you see that they're almost identical to the United States. So we have heart disease at number 1, cancer at number 2, stroke at number 4, and chronic lower respiratory diseases at number 5. So very identical to the United States. And tobacco plays, again, a huge role in these deaths that are occurring in our state. So anytime you go to the store and, you know, the supermarket, and you're interested to know what exactly it is you're cooking for yourself or your family, there's something very neat on the back of the packet or somewhere on the packet that not only has a list of all the ingredients that is in the food, but also a nutritional breakdown, how much protein's in it, how many carbs, and, you know, you understand what it is that you're putting into your body. But there are no nutrition labels on any type of tobacco products. So we thought that we would supplement that with some facts about what exactly are in cigarettes. So the first fact is that there are 7,000 different chemicals in cigarettes. Some include common household products like acetone and toilet bowl cleaner, just things you really do not want to be putting into your body. These chemicals are highly toxic and can cause a lot of health issues. The second fact is that there's 2 milligrams of nicotine in every cigarette. That's about 40 milligrams per pack. It only takes 100 cigarettes to be addicted for life. If you think about that fact specifically, there are some people who have a pack a day habit. So it means that they are smoking that amount of cigarettes in less than a week. So it just goes to show that nicotine is something that is extremely addictive. And then the third fact is that vaping companies use facts about quitting smoking as advertisement for the benefits of making the switch to vaping. This kind of marketing is very false, deceitful, but unfortunately, that type of deceitful marketing is very traditional for tobacco companies. It's something that they have always done ever since they've been in existence. I can think of a couple good examples. One would be Virginia Slims, decades ago, used to advertise specifically towards young women, saying that if they smoke, they'd be able to get skinny or stay skinny. And unfortunately, there was a consequence to that type of deceitful advertisement, as we saw an uptick and a rise in the rate of young women smoking. They've also traditionally marketed menthol cigarettes towards Black communities, and menthol cigarettes are seen as more addictive than regular cigarettes, or non-menthol cigarettes, I should say, because they have a cooling sensation that makes it easier to smoke, so they're more addictive. And unfortunately, you know, it is something that we see the highest rate of menthol cigarette usage in the Black community. So this deceitful marketing does have consequences. So we're going to make it a little bit interactive. If you guys want to put your answers in the chat. But we have our first true or false question. So true or false, cigars are safe. What do you guys think? And I'm not sure if I could see the chat. Okay, there we go. Anybody have a guess as to if cigars are safe? Cigars are also a type of a tobacco product. So for this question specifically, it's definitely false. It's definitely false. There is this misconception that cigars are safe because you do not inhale the smoke, but you're still inhaling a little bit, first of all. So those toxic chemicals are still getting into your lungs. But cigars cause a large amount of the mouth cancer that we see. You are at an extremely high risk for developing mouth cancer, also cancer in your esophagus, and as well as heart disease even. So cigars are not safe. You're still exposing your body to these very harmful chemicals. It also has been known to cause gum disease and many other type of oral diseases. So there has been a slow decline in the use of tobacco products. That is true. We don't see people smoking as much as we used to. But tobacco education and regulation remains a major topic and issue at the CDC because, as we see, tobacco usage still contributes to such a significant amount of the deaths that occur in our state and in our country as well. So, if you guys do have the time, I highly encourage you to check out the CDC's website. They have great information. They're constantly publishing new information as well. So let's talk a little bit more about what is a cigarette, this thing that is causing almost 500,000 deaths in the United States every single year. So, let's start off with talking about nicotine. What exactly is nicotine? So nicotine exists naturally in the tobacco plant and combusted tobacco products. So it's very important to make this distinction. Combusted tobacco products are products that you have to light with fire in order to consume them. So they produce products, a byproduct of tar and carbon monoxide. It is a stimulant drug. Nicotine is a stimulant drug that attaches onto nicotine receptors in the brain. When it's consumed, it subsides cravings and creates a relaxing sensation that does slowly decrease. It only takes 6 seconds for nicotine to reach the brain. It's a very fast reaction. And it is found to be as addictive as cocaine. And so a lot of people really don't realize how addictive nicotine is because, I could walk down the street to Wawa right now and buy a pack of cigarettes, but I can't buy cocaine. So just because it's commercially available does not mean it's any less addictive than some of these other hard drugs. We talked to people in our cooperative as well who said sometimes they even have a harder time quitting smoking than they did quitting other drugs or substances that they were using. And I also want to kind of make a distinction between nicotine and other chemicals that are found in tobacco smoke. Nicotine is just the addictive portion of a cigarette. There is not a lot of evidence or studies that have come out and have said that nicotine causes any significant harm to your body, but it just gets you addicted to the product. And it's the 7,000 chemicals in those cigarettes that are really harmful for you. So that's why nicotine replacement therapy is a FDA approved, very good method to help people quit smoking. And we'll talk a little bit more about nicotine replacement later in the presentation. So then we have combustible cigarettes. These are cigarettes, again, that are used, you have to light to use them. And here are just some of the leading market shares for the leading cigarette brands. Marlboro is still definitely at the top of the industry, having 40% of the market shares. So here we have, again, just a handful of the 7,000 chemicals that are found in cigarettes. We have ammonia, which is also used as toilet cleaner. Ammonia also increases the absorption of nicotine, making you more addicted to the cigarettes, essentially. We have arsenic, which is literally poisonous and toxic to your body. It raises your risk for multiple types of cancer and heart disease as well. We have acetone, which is, I use it to take off my nail polish. People use it as a paint stripper. Again, just very toxic. And if you smell acetone, it's a very strong scent. Like, it's just not something you want to be putting into your body. Then they have things like methanol, which is used for rocket fuel, lighter fluid, barbecue lighter. And that's things that they put in the cigarettes just to keep them lit throughout. And these are just very toxic chemicals that you do not want to be putting into our body. Our lungs are supposed to breathe in the air around us, the ambient air. They're not supposed to breathe in any of these chemicals. So here we have another true or false. This is a common question that we get asked, but it's that natural cigarettes are safer than regular cigarettes. And so I see that the chat is disabled, so I'll just, walk through it. So this is false. The tobacco industry goes out of its way to add these misleading labels on their products to make it seem like some of their products are healthier than others, but that's just not true. When they give this distinction of natural cigarettes, it means that there are no additives to the physical growing process of the tobacco plant. So maybe they didn't add a pesticide when they were growing the tobacco plant. But then when they manufacture the cigarette, it's absolutely the same. You're still breathing in the 7,000 chemicals. You're still getting exposed to tar and carbon monoxide, which is really not healthy for you. And so they are not safer than regular cigarettes. And this is a common misconception amongst people who amongst smokers who do buy cigarettes. They think that these products are safer than others, but they're not. So now moving on to e-cigarettes. So in 2020, data released by the CDC said just under 20% of high school students and about 5% of middle school students are current e-cigarette users. So, I mean, that is a lot of young kids using these products. It's unfortunately really taken over our youth in like the past 5 to 10 years. So what exactly is an e-cigarette? Very simply, it's a battery-operated device that people use to inhale nicotine. The biggest difference between regular cigarettes, cigars, and e-cigarettes is that you don't have to light them in order to use them. The way that they work is that there is an e-liquid usually contained in a pod or a cartridge that includes nicotine, other additives and flavoring, other chemicals as well. Each company has their own recipe, and basically when someone inhales on the device, a sensor will trigger the device to heat up that nicotine and form that e-liquid that contains nicotine and form an aerosol. And this aerosol is breathed in and exhaled back into the environment. So the claim that these products are healthier began by saying, well, when you smoke these, you're not getting that tar exposure. You're not getting that as many chemicals. So you're not breathing in the 7,000 chemicals because it's not combusted. You don't have to light it in order to consume it, but it is rather heated. But that's just not true. There's still many toxic chemicals in these products, including heavy metals like nickel and lead that has been found in them. There's also a lot of carcinogens. They found naphthalene and formaldehyde as some of the chemicals that are found in these products. So still very, very unhealthy. And what's very scary about this new vaping epidemic is that we don't know the long-term effects of using these products regularly. I mean, it's almost like this generation is the guinea pigs to see what the long-term effects are by using these products. And even though we don't know those long-term effects, we haven't gotten a glimpse of the acute effects. And it's something that is very concerning to communities, healthcare professionals, parents, doctors. And, in 2019, there was thousands of hospitalizations with this outbreak called EVALI, which is e-cigarette and vaping associated lung injury. And basically, some of these symptoms from EVALI included severe fever, shortness of breath, coughing, nausea, vomiting. And most of the people who were hospitalized were under 35 and were using products that they found had diacetyl in them and caused popcorn lung. And it was something that was very tragic. Unfortunately, about 70 young people died from EVALI in 2019. So again, we haven't seen the long-term effects, but we've gotten a glimpse of the short-term effects, and they have been very, very scary, and it's very serious, and it's an issue that continues to ravage our youth today. So what's the problem with vapes? I know I kind of dove a little bit into it on the last slide, but let's, add a little bit more context to what's going on. So the first problem is that the e-cigarette and vaping industry was not regulated by the FDA until 2016, and these products entered into the market in 2007. So, that's almost 10 years of these products being used by consumers, and nobody knows what's in them. Nobody knows what they're smoking or vaping. Once the FDA reviewed these devices and the ingredients, we saw an automatic push to ban flavors. Very famously, Juul pods were pretty much all flavors were banned except for 2. And it was because they were so concerned about what was in these products. And then the second problem is that the industry does not need to comply with the Master Settlement Agreement. Just to add a little bit more context to this point, the Master Settlement Agreement was basically a law or a settlement reached back in the late 90s between the states and Big Tobacco. Big Tobacco had sued the states, had sued Big Tobacco to basically reconcile the billions of dollars that they had spent treating tobacco-related illnesses. And, what this did was not only force Big Tobacco to pay back the states, but it heavily regulated the tobacco industry, especially its marketing practices. So that's why we don't see, Newport or Marlboro sponsoring the Yankees anymore. It's why we don't see cigarette commercials on our TV or radio ads as well. Unfortunately, the vaping and e-cigarette industry is seen as different. So they don't need to comply with this rule. And they began their target marketing at teens. And unfortunately, this type of marketing had very detrimental consequences because it created an entirely new generation of addicted nicotine users. And what's frustrating for us who work in tobacco cessation is because some of these big tobacco companies own these smaller vape companies, and they basically are just finding a loophole to get past the Master Settlement Agreement and market their products. So now moving on to environmental tobacco smoke. So like I said before, anytime you smoke, it doesn't just affect you, it affects everybody around you who's also getting exposed to that smoke. So we have firsthand smoke, and that is a smoke that is inhaled from a tobacco product, including vape products. And then we have secondhand smoke. This is a smoke that burns at the butt of the cigarette and the smoke that is exhaled after a hit that goes into the ambient air. And then we have third-hand smoke. A lot of people aren't really aware of third-hand smoke, but it is very dangerous as well. This is the residue that lingers after the cigarette and vape smoke is gone. So talking a little bit more about secondhand smoke, if you're walking past someone who's smoking, and you happen to, breathe in that smoke, unfortunately it does happen. You are breathing in the same amount of toxic chemicals that smokers breathe in. It contains 7,000 chemicals that firsthand smoke has. And it itself, secondhand smoke itself, is considered a carcinogen. A carcinogen is a substance that is known to cause cancer, proven to cause cancer. There is no safe amount of secondhand smoke exposure. So this is why it's so difficult, this is so important to make sure that, if you do smoke, to try your best not to smoke around other people, because they are getting exposed to those chemicals as well. And then we have third-hand smoke. This is particulate and chemicals that can be found on fabric, clothing, hair, and porous surfaces. Third-hand smoke remains in the room for many hours after the last cigarette. It sticks to those walls. It makes its way deep into your furniture, and the residue mixes and settles with dust. It drifts down to the carpeting and furniture surfaces and makes its way deep into porous material in paneling and in drywall. So my grandparents, they would smoke in the house all the time. And, I would notice that their walls would be like very yellow, and it was impossible to get out. My mom tried to clean it so many times, and that was a third-hand smoke that had just accumulated there after years and years of smoking in the house. It is very difficult to get rid of third-hand smoke. Like airing out your house really isn't enough, and a lot of common household cleaning products don't do a great job of getting rid of it altogether. And if you think about who is most at risk for third-hand smoke exposure, it's young kids because they go and they touch everything with their hands and then, they tend to put their hands in their mouth. And also pets, our pets, they will run around and then lick themselves and they're getting exposed to that third-hand smoke when they touch things with third-hand smoke and then um, um, put, their hands in their mouth. So it's something that is very dangerous. There's over 250 chemicals in third-hand smoke as well. So here we have another true or false, and it's that smoking relaxes me and being relaxed is a good thing. So a lot of people say that they smoke because it's a stress reliever. And it's very difficult for me to tell them sometimes, unfortunately, like it's not relieving your stress, it's you're satisfying your addiction. They get used to, your brain gets used to nicotine, they get used to nicotine, and all of a sudden the brain feels like it needs nicotine just to feel okay. So when they're feeling anxious or stressed, a lot of the times it's actually nicotine withdrawal. And so they know that smoking will relax them and satisfy that craving. So, that's why they think it's a stress reliever. But unfortunately, it is an addiction, not a stress reliever. So how do I quit? We've spent a lot of time talking about the horrible dangers of smoking cigarettes and e-cigarettes. So how do we actually start to prepare to quit cigarettes and quit smoking? So here are just some very quick tips that we think could help you as you are starting to begin your quit journey. So treat yourself well. It's very important. When you quit smoking the first couple of weeks, it could be very difficult. So make sure you're taking care of your mental and physical health. Regular exercise is something that's extremely important. In fact, studies have shown that exercise has eliminated and reduced cigarette cravings significantly. And when it comes to exercise, I'm not telling you to go and run 10 miles. This could be a very brisk walk outside, but it's just a matter of getting your heart rate up. So it kind of distracts your body from that high anxiety time of having nicotine withdrawals. Change your routines. A lot of people don't realize exactly how much they smoke because it's so ingrained in their routine. So we tell people to, try to change it, try to journal, see how much you're smoking, see what part of your routine it's attached to, whether it's, you smoke right after breakfast, maybe, instead of, right after breakfast, you go straight to your car and straight to work. Just little things like that can help eliminate smoking from your daily routine. And do something enjoyable every day. This goes hand in hand with treating yourself well. Reducing stress, also very important. I understand that a lot of times this is out of our control, whether it's, stress at home with your job. But it's really important to set boundaries and try to create as much of a supportive environment for yourself as you can. And increase non-smoking social support. Unfortunately, smoking can be a social activity. So make sure you're, again, setting boundaries with maybe those friends or coworkers who you do smoke with. Say, hey, maybe don't invite me out for a break to smoke. I'm trying to quit. And also surround yourself with people who are supportive and are willing to help you out as you're on your quit journey as well. So let's go over some recovery symptoms. We call them recovery symptoms because your body is recovering and adjusting to not having nicotine, which is a good thing. The feelings, they do feel bad, but it's your body in recovery. So cravings. Strong cravings usually last a few weeks. They can be managed with nicotine replacement therapy. Talk to a doctor or a tobacco treatment specialist, and they could help you with which nicotine replacement therapy is best for you. Irritability, also very normal. You can have mood swings, feel stressed, overwhelmed, have trouble sleeping. Also, again, just very normal. And withdrawal. This is a normal symptom of your body adjusting to not having nicotine. And again, very important to talk to your physician about how to manage these symptoms with nicotine replacement therapy. So let's talk about some of the medications that are available to help people quit smoking. So what nicotine replacement therapy is, very briefly, is that it delivers a dose of nicotine to your brain to satisfy those intense cravings or withdrawal, but you're not getting those 7,000 chemicals. And a lot of people are worried of, what if I get addicted to the nicotine replacement therapy? That's why it's very important to talk to a doctor or tobacco treatment specialist because they know how to dose you properly. They also know how to measure your level of dependence to nicotine and choose the right treatment plan for you. So we have some medicines available by prescription. The first two are non-nicotine medications. So we have Zyban, also known as Wellbutrin, has been used to help people quit smoking. Chantix is also a great option. I've heard very good things firsthand from people who've quit smoking using Chantix, and also available by prescription. You have the nicotine inhaler or nasal spray. These are very fast-acting nicotine replacement therapy delivery methods. So that is why, they're available by prescription. And again, just very important to talk to your doctor. They're very educated on this subject, or tobacco treatment specialist, so they can pick the right treatment plan for you. And available over the counter is the nicotine patch or the nicotine gum. And even if you want to go over the counter, I just want to stress talking to a tobacco treatment specialist, because a lot of people have reported to us and said, I tried the patch for months, it didn't work, or I tried the gum, but it could be that that is just not the right NRT for you. Again, they're trained to measure your level of nicotine dependence. They're trained to analyze the habits that are associated with your smoking and basically choose a treatment plan that's best for you. So here we have another true or false. The damage is done. There's no point in quitting. So this is absolutely always false. You feel the positive health benefits of quitting smoking almost immediately after you put out your last cigarette. And here we have, some of the quitting benefits. So after 20 minutes, your blood pressure and heart rate return to normal. After 1 day, the carbon monoxide is eliminated from your body. Your lungs begin to eliminate mucus and debris. After 72 hours, your breathing becomes easier, your bronchial tubes relax, and your energy levels increase. Between 2 to 12 weeks, your circulation improves. 3 to 9 months, your lung function increases up to 10%. And then you feel the coughing and wheezing and the breathing problems reduce. And this statistic right here always blows my mind. After just 1 year of quitting smoking, your heart attack risk is decreased by 50%, by half. That is a major statistic, it's a major benefit of quitting smoking. After 10 years, your lung cancer risk is decreased by 50%. And after 15 years, your heart attack risk is the same as for someone who never smoked. So there's benefits for quitting after the first 20 minutes, and there's benefits to quitting after the first year, 10 years, 15 years, 20 years. It's always healthier to quit smoking, and it's never too late. So I think we have, I think this might be the last true and false, but light cigarettes are less harmful than regular cigarettes. This is false. Again, this is the tobacco industry adding misleading labels to make it seem like some of their products are healthier than others, and it's just not true. Light cigarettes has to do with the amount of tar that is that you're exposed to when smoking this product. But studies have shown that you can get the same amount of tar exposure from light cigarettes as long as you inhale deeper and longer as you're smoking them. So again, just completely false. These products are not safe. So now quickly, I'll go over some of the New Jersey smoking cessation resources. I know Trixie talked about some of the resources available from Atlantic Health. But, just adding a little bit more information, you can never have enough resources, in my opinion. So starting off with the New Jersey Quit Line, this is a free telephone and web-based counseling for people who live in New Jersey. You do need to be ready to quit to use this service. What you get is 5-member sessions with a quit coach, and they also have chat services for the youth, so ages 13 to 17. It's 24/7 access. They're multilingual. Our quit coaches are trained in special populations like BIPOC and also the LGBTQIA plus community. You get free nicotine patches for qualified adult members. And this is great because studies have shown the people who have the most success quitting smoking use a combination of behavioral health therapy, like talking to a tobacco treatment specialist, and medication. So using nicotine replacement therapy or Chantix or Wellbutrin. So when you use a combination, you're 48% more likely to quit smoking. And the New Jersey Quit Line offers both. So it really is a great service, very easy to get referred to. All you have to do is either call the number on the screen or visit njquitline.org. And then we have Moms Quit Connection for families. This is free unlimited smoking cessation for pregnant individuals or parents and caregivers in the state of New Jersey. To qualify, you do have to have children under 8 years old or be pregnant. But I always tell people, if you think there's a chance you might qualify, go for it. They are really trying their best to get as many people into the program as they can. I've had someone tell me, oh, well, I babysit like a couple times a week and the kids are under 8. And I was like, sign up, like they'll try to get you in. So don't let this discourage you from trying to sign up for the program. You do not need to be ready to quit, which I think is amazing. You just have to be ready to have a conversation about your tobacco usage. It's face-to-face counseling in the southern region and virtual counseling for the northern and central region. And very easy again to get referred. I think the easiest way would be to visit the website. So go to www.momsquit.com. You can input all your information and they'll start onboarding you as soon as they can. And then we have the quit centers. These are physical buildings that are in 11 of the counties throughout the state. They are in-person, individual, or group counseling, and they also have free nicotine replacement therapy for those who qualify. If you go to Tobacco Free NJ, they have this awesome interactive map where all you basically have to do is click on the map, see which place is closer to you, find out their hours, the services that they provide, and much more. And then we have the This Is Quitting program. This is definitely a youth-focused vaping cessation program, but anybody can use it. It's basically headed by the Truth Initiative. We help them run it here in New Jersey. And all you have to do is text Vape Free NJ to 88709. It's free, anonymous text to quit program. You talk to real tobacco treatment specialists. It's not a robot, and it's a very effective program and completely anonymous as well. So that's all I have for you guys today. I want to thank you so much for the opportunity to present. I hope that you were able to get something out of it.
Hey, thank you, everyone. We appreciate you joining us today. We kindly ask that you take a few minutes after the webinar to complete the program survey. The link to the survey has also been added to the chat for your convenience. And a special thank you to Riza for dedicating your time and experience today. If you have additional questions or comments, you can send us an email to communityhealth@atlantichealth.org, or you can always give us a call at 1-844-472-8499. This concludes our webinar, and thank you, everyone.